Good day, everyone. Especially to my teacher, Ma'am Branzuela. Good day. Today's video. By the way, my name is Principal Gianan. And now I am here in Binugao, Toril, Davao City. In this video, I will be going to tackle about what is a postmortem. So before I proceed, the definition of postmortem. So uh, always remember that the postmortem and autopsy is there's a differentiation. So today, what is a postmortem? Postmortem it is an examination, also known as an autopsy. Is the examination of a body after death. The aim of a postmortem is to determine the cause of death. Postmortem are carried out by pathologists or doctors who specialize in understanding the nature and the causes of disease. So, what are the difference between postmortem and autopsy? So, the autopsy involves dissecting the body and its vital organs to try to discover why the person died. So, a postmortem is an open inquiry held in public to try and establish the likely causes of death. For example, if it was a suicide or a death by some other cause, no surgery is carried out on the body. So, what are the four post-mortem stages of death? There are four stages, which is the pallor mortis, algor mortis, rigor mortis, and labor mortis. So, death is one of the fundamental facts of our life. So, after we die, there are four stages of changes that occur in the body. They are used primarily to determine the time of death or post-mortem index or PMI in forensic pathology. So pallor mortis is the first stage of death. Is an after death paleness that occurs in those who light or white skin and up to electronical color measurement device is used to measure pallor mortis on bodies. The second stages of postmortem is algor mortis. So, what is algor mortis? Algor mortis is translated from Latin as cold death. So, and describe the postmortem temperature change after someone has died. After death, individuals to longer produce body heat or cooling mechanisms, and the dissident temperature slowly so approaches ambient temperature. So the third is rigor mortis. Rigor mortis is a post-mortem change resulting in the stiffening of the body muscles due to chemical changes in their myofibrils and myofibrils. Rigor mortis help in estimating the time since death, as well to ascertain of if the body had been moved after death. So in the last stage of postmortem is a livor mortis. So livor mortis is also known as lividity or hypostasis, is the gravitational pulling of blood to lower defendant areas, resulting in a red or purple coloration. So although livor mortis is commonly seen between 2 and 4 hours post-mortem, its onset may begin in the early period, as little as 30 minutes post-mortem. So, what happens during a post-mortem? So, uh, pathologists perform post-mortem examination to standards set by the Royal College of Pathologists. These standards include carrying out the post-mortem in a respectful manner and with regard for the feelings of the bereaved relatives. Most Postmortems are carried out by a pathologist who specializes in histopathology, which is the laboratory study of disease and diseased tissue. So pathologists are helped by anatomic pathology technologists who had who have had specialist training to assess pathologies. Postmortems are usually carried out the the hospital mortuary in a specialist postmortem in a special postmortem examination room, which is similar to an operating theater. In certain circumstances, they may be carried out in the local public mortuary. So this is what I have said earlier, that about the differentiation between the postmortem and autopsy. So public mortuary, so or in a regional center for specialist postmortems. So the body will be moved respectfully from the place where the person died to the place where the examination is to be carried out. So a long incision is made down the front of the body to enable to internal organs to be removed and examined. So a single incision across the back of the head allows the top of the skull to be removed so that the brain can be examined. So organs are examined carefully with the neck, eye, and dissected to look for any abnormalities such as blood clots, or tumors. So if further information is required, stem size pieces or tissue may be retained for examination under the microscope, or samples of body fluids taken for analysis in the laboratory. So that would be all. So I hope that you have a lot of understanding about my topics. So good day. That would be all. Thank you.